Well, I would like to welcome everybody back to the brain injury discussion. This is your host, Jay, and today we're going to talk a little bit about an overview of seizures and how it pertains to brain injury and what maybe to do. Um, again, this is just a very brief overview, and we're not going into this very big specifics of this because this could be a topic that could take years to talk about. But with that being said, like always, we do appreciate a thumbs up on this video. Again, subscriptions to this channel are awesome. We appreciate that. And if you learned something new, feel free to leave it in the comment down below. We always love hearing feedback. And if you have a topic you'd like us to cover, we'd appreciate that. Like always, sources will be on the last slide and in the description below. I encourage you to read those. But anyways, let's get started with seizures. Now, what is a seizure exactly? Well, let's look at this thing called an EEG, which is an electroencephalogram, which is this image down below. So, what we're looking at here is a section of normal brain electrical activity. In between, at the beginning here, and then what we'll see is that abnormal brain activity here. And again, this is the actual thing behind the seizures. It's the abnormal electrical activity. And it may be temporary, it may be for a period of time, and then it'll go back to normal brain activity. But what we're really seeing is that with seizures, it's the uncontrolled or an abnormal electrical activity inside of the brain. And there are many causes. And again, all of these are different causes that can not only cause a brain injury, they can also cause seizures. So seizures and brain injury kind of go hand in hand. And when we wrap up this slide, wrap up this presentation, we'll kind of put this all into why this matters. But think about electrolyte imbalances, like um, the glucose. You've probably seen the episode about that. Hyponatremia with sodium or calcium. Too much or too little of one of those, as well as the electrolytes, is usually a bad thing for the body. So we want to keep electrolytes balanced, not just so we can prevent seizures, we can also prevent brain injuries that way. Infections of the central nervous systems, infections in the brain can definitely cause a seizure as well. Same thing with sepsis. Um, if you've been hit on the head with a traumatic brain injury, or maybe you had a different kind of a brain injury, or maybe medication or there was a substance withdrawal. This is especially known with like alcohol withdrawals. You can have seizures if you have severe alcohol withdrawal symptoms. Seizures can be a side effect of that. It can also be caused by fever or febrile illness. So, if there is swelling or if there is, the brain gets too hot, it can definitely cause this abnormal electrical activity. Kind of obvious cancer or a neoplasm that can definitely cause seizures as well. Also, it can be a brain injury. Um, but also a stroke can cause seizures. So those are some of the causes of seizures, and those are a lot of brain injuries as well. So that's why it kind of goes hand in hand. This is why a brain injury case manager like myself should at least be aware of the basics about seizures. So with that being said, let's go from the least severe types of seizures, and we'll work our way through the more severe kind of seizures. So let's look at what's called partial seizures or focal seizures. And this image and graphic on the right here is a great explanation of it because focal or partial seizures are strictly located in a part of the brain. So that's why it's called partial or it's focalized. And so as we can see in this graphic here, it is strictly located to this rear area of the brain. And we see that the electrical activity is normal and then it goes abnormal. So the majority of the new cases of epilepsy are usually focal seizures, and it's about 60% of the new cases. Um, and they can be subdivided into two different types. So the simple and the complex. Simple, mainly talking about consciousness not being impaired. So again, this is the mildest seizure that I was able to find. And the consciousness not being impaired, obviously, there's still abnormal brain electrical activity, and that still constitutes a seizure. Now, a partial, which is a complex partial seizure, consciousness is affected either partially or fully. So keep that in mind that partial if it is a complex partial seizure, it can in fact be impairing the person. Uh, and these partial seizures can actually, and I stress can, evolve into generalized seizures, which will take us over to the next slide where we're going to talk about generalized seizures. Well, let's take a look at this graphic on the right here, and you're going to see that instead of it just being in one particular location, it's all over. A generalized seizure, general means all over the place, so usual. We're seeing the seizure everywhere, and there's abnormal activity, not just limited to a focal point into the brain, but everywhere in the brain. And we see that on an EEG, there will be lots of abnormal activity on all different points. So there's 6 different types of generalized seizures, and we're just going to briefly touch on them. We have what's called absence seizures, where the body may move, there might be eye movement, but there's usually no convulsions. We have what's called myoclonic, where we might see some extremities like hands, toes, feet. Um, we might see some jerking motions in there. We might see that electrical activity translate to motor movement that's a little erratic in the extremities. Then we have what's called clonic, which is repetitive motor movement and activity. So we're seeing that repetition, that motor movement. It all stems from that electrical activity. And then we have what's called tonic, think tone, think of muscle tone. That's the same root word for tonic. And if someone's got muscle tone, they will have rigidity or tension. It'll be stiff. Someone who's toned up in the muscles will have, hardness there. So that's rigidity. Um, and there's also what's called grand mal, which is a combination of tonic and clonic seizures types, where you're going to see both muscle rigidity, stiffness, tension, but you're also going to see lots of motor movement within those muscles. So you'll see both. That has been called grand mal, which should not be confused with it is a type of generalized seizure, but not all generalized seizures are grand mal. In fact, that's only a portion of them are grand mal. And then we have what's called atonic seizures, which is loss of rigidity. It's quite the opposite from tonic seizures, as is noted by the word, where the muscles go away from rigidity. So it just kind of loosens up. So they'll be very loose in the muscle. And again, this all stems from the abnormal brain activity, which is seen by EEGs. And so, again, those are the 6 types of generalized seizures. Now, you might be asking, well, Jay, now that we know kind of what seizures kind of are defined by and what they kind of look like, um, what should we do if someone has a seizure? Well, according to the CDC, there's quite a few things that you can do. But just like in every medical emergency, the first thing you should do is remain calm. All right, remain calm. Calm equals calm. If you're calm, other people are calm. And you want to stay with the person who is having the seizure. You don't want to leave them alone. Stay with them. All right. You want to give them that safe environment. So if they're like this person on the ground, might want to move some objects away from them. You might want to prevent the injuries. I talk a lot about prevention on this channel, and we want to prevent brain injuries. We also we can do that when someone's having a seizure. If there's an object near them that, especially near their head, which could cause an injury, let's move that away. Let's create that safe environment for them. Also, in order to preserve the airway, we should turn them to their side if they are already on the ground, like this person. This person here, ideally, we want to put them on their side. We want to support their side so that way any sort of foaming at the mouth, any sort of body fluids that are coming out of the mouth drain outwards. We want a clear airway. That way, It just drains out. Again, don't care about the fancy carpets, don't care about the new hardwood floors. You want that stuff out of the mouth so it does not impede that airway bringing oxygen to the body. So that is extremely important. If the seizure is longer than 5 minutes, call 911, get first responders involved. All right. If it's loud, if when someone starts a seizure, take note of the time and maybe not a rigid 5 minutes, but if it's been a while and it's still going, call 911, get professionals there, get the EMS there, get first responders there. If it is not longer than 5 minutes, offer to call, be supportive. Hey, who's your emergency contact? Who should I call? Do you want to go to the hospital? Those are questions you should be asking. And of course, be supportive in the care. So you want to kind of support what's going on. You want to support their recovery because this is in fact serious. This could take them out for the rest of the day because this is a very, taxing thing for the body. And so, what does that lead me as a case manager to conclude? Well, this is something that we should be well aware of. It's called a seizure action plan. And this is a preparation document for those who have had seizures in the past, right? If you've had seizures in the past, this would probably be a good idea to have either in your wallet or in your purse, maybe somewhere on your person. If a random person is the person who sees you having a seizure, they're not going to know you, they're not going to know your emergency contacts. And it is a personalized plan between you and your doctor um, to what to do in the case of a seizure, especially if you've had seizures in the past. This is a document outlining what to do, what medications you're on, um, especially if it goes over that 5 minute mark and you're calling first responders. This is something that can go with them as well as their emergency information. So um, it's good information for the person to have if they're not able to communicate their information during a seizure. Um, this would be that document with that information. It'll have all the important stuff, who to call, who to notify, um, and how to notify them as well as the person's information that they will need to treat. Again, think about the prevention and planning things. I like to talk a lot about prevention and planning and a seizure action plan. We tend to utilize them in case management if you've had a history of seizures because it does have a lot of that crucial information and it's documented. Instead of having to guess, it's on paper. It's all right there. And so it also contains instructions. So with that being said, think about a seizure action plan if you know someone with a seizure or have a history of seizures. Those are my resources. But remember the first aid for a seizure. You want to stay calm and stay with them. Make it a safe environment, prevent injury. Turn the person to their side if you can. Call 911 if it lasts longer than 5 minutes. Offer to call emergency contacts if less than 5 minutes, or maybe even after. Um, and then provide that support for someone. But with that being said, I think I will leave it here. Don't forget, sources are in the description below. We'd appreciate a like as well as comments, and feel free to subscribe to this channel for more information like this. We like putting out good information. That way we can be educational and we can also educate and prevent future brain injury. Or maybe um, we can not only prevent future brain injuries, but maybe um, we can help people who already have brain injuries. So feel free to share this with someone. And if you have any questions, feel free to put it in the comment section below. But until then, I hope you all have a wonderful day. And don't forget to protect your brains.